Councilmember Gray, we're just waiting on another colleague to join so we can have quorum and begin.
Okay, thank you.
Okay. We're good? Awesome. Good afternoon. I'd like to call this meeting of the Committee on Health to order. Today is Tuesday, October 10th, 2023. The time is 3:04 p.m. I'm at-large Councilmember Christina Henderson, Chair of the Committee on Health. I want to note that we have a presence of a quorum with Council Members Vince Gray from Ward 7 and Councilmember Brianna Doe from Ward 1. Today, we will consider three measures before the committee. PR 25-290, the Director of the Department of Health, Dr. Ayanna Bennett, Confirmation Resolution of 2023. Bill 25-226, the Access to Emergency Medications Amendment Act of 2023, which was introduced as the Access to Emergency Albuterol and Glucagon Amendment Act of 2023. And finally, Bill 25-244, the Prescription Drug Monitoring Program Amendment Act of 2023. PR 25-290 would confirm Dr. Ayanna Bennett as the Director of DC Department of Health. Dr. Bennett has been serving as the Acting Director of DC Health since July of 2023, replacing Interim Director Dr. Sharon Lewis, who served in that role since Dr. LaQuandra Nesbitt left the position in July of 2022. Dr. Bennett is a pediatrician with over 20 years of clinical and public health experience. She earned her MD and completed her pediatric residency at UC San Francisco Medical School and earned her master's in Health and Medical Sciences from UC Berkeley School of Public Health through a unique program for doctors in training focused on health equity. From 2007 to 2016, Dr. Bennett was a practicing pediatrician, including founding and leading the 3rd Street Youth Center and Clinic in San Francisco. In 2016, Dr. Bennett joined the San Francisco Department of Health as the director of the interdivisional initiatives, where she focused on long-term population-based initiatives like the Black African American Health Initiative, which sought to address health disparities of San Francisco's Black residents. In 2019, Dr. Bennett became the founding director of the Office of Health Equity for San Francisco's Department of Public Health, creating anti-racism agency goals, policy improvements, and training to reduce interpersonal bias. She also co-led the COVID Emergency Operations Center for the city and county of San Francisco, overseeing 600 employees and a $460 million budget, resulting in the lowest case and death rate among major American cities nationwide. As the director of DC Health, Dr. Bennett would oversee over 750 FTEs and lead the district's effort to protect and enhance public health across a broad range of factors, including chronic disease prevention and treatment, maternal and infant health, infection disease surveillance and immunization, health emergency preparedness and response, and HIV/AIDS prevention and treatment. Dr. Bennett would also oversee the regulatory oversight and licensing for health professionals, healthcare facilities, food safety inspections, animal control, and health and hygiene inspections of businesses across the district. I was impressed with Dr. Bennett's testimony at her confirmation roundtable last week, where she shared more of her background and her philosophy on collaboration and the desire to make data more accessible and available. She gave examples from her previous experience of turning talk about health inequity, into action and tangible results, and how she plans to do the same at DC Health. After learning more about her experience and plans for the agency, I do believe that Dr. Bennett is ready and capable of taking on this very important role. At this time, I'd like to open the floor for discussion for PR 25-290, the Director of the Department of Health, Dr. Ayanna Bennett, confirmation resolution of 2023. I also want to note that we've been joined by Councilmember Charles Allen from Ward 6, who is a member of this committee. Does anyone have any comments about Dr. Bennett's confirmation? I can't see everyone. So if you want to talk.
Chairperson Henderson.
Oh, we've been joined by Councilmember Parker from Ward 5. Councilmember Parker.
Yes, I wanted to speak in favor of the confirmation of Dr. Ayanna Bennett, who I think will bring a great level of expertise and stewardship for the Department of Health as the district emerges from COVID-19 and what will come thereafter. We were talking just this morning about the intersections of health in schools, and I know we're going to take up a bill just in a little bit, but we have a lot to benefit from Dr. Bennett, and I'm looking forward to voting in confirmation. So we have a meeting coming up, and I've heard a lot of great things, and I'm hoping that what we can do is ensure that there is more synergy between the Department of Health and our school system and the health coverage that is provided by way of nurses and a host of other things. But having heard parts of the hearing last week, I have the confidence that Dr. Bennett will lead the agency in the right direction. Thank you.
Thank you, Councilmember Parker. Anyone else have any comments? Okay. Hearing none, I'd like to now move the committee print as well as the accompanying committee report for PR 25-290 with leave for staff to make technical changes in consultation with the Office of General Counsel. All in favor, please say aye.
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 Okay, let the record reflect that that was a unanimous vote. The next measure we will consider is Bill 25-226, the Access to Emergency Medications Amendment Act of 2023, which was titled the Access to Emergency Albuterol and Glucagon Amendment Act of 2023 when it was introduced. I introduced this bill in March, on March 20th, 2023, alongside Council members Allen, Nadeau, Parker, Lewis, George, Bonds, and Pinto. This bill, crafted in collaboration with Children's National Hospital, would ensure that when a student is having a medical emergency, schools are prepared with emergency medication and staff is trained to provide immediate care. While the bill as introduced was limited to emergency albuterol for students suffering from an asthma attack and undesignated glucagon for students suffering from hypoglycemia due to diabetes, the committee print expands the scope of the act by requiring DC Health to develop an undesignated emergency medications action plan. Through this plan, DC Health will create a system for stocking undesignated emergency medications, included but not limited to albuterol and glucagon at schools. DC Health requested this broader authority to create a more nimble system as new medications become available and our students' health needs evolve. Current law mandates that students enrolled in public schools and public charter schools have a medication action plan to self-administer asthma or diabetes medication. The parent, legal guardian, or student must obtain authorization on the medication action plan from a licensed practitioner to enable self-administration of medication. In the case of an emergency where a student without a medication action plan is showing signs of an asthma attack or hypoglycemia due to diabetes, school staff are currently not trained to administer undesignated medication, and there is no undesignated medication available to students. This exponentially increases the health risk for students, since only 15.2% of students with asthma have an action plan. Again, I say only 15.2% of students with asthma have an asthma action plan, and 71.7% of students with diabetes have a diabetes management plan. Therefore, in the case of a medical emergency, almost 9 in 10 children with asthma would not be able to access albuterol and 1 in 3 children with diabetes would not be able to access glucagon immediately. As we heard during the hearing, this has a significant health equity issue since Black and Latino children experiencing asthma at significantly higher rates than white children and are more likely to visit the emergency room due to this condition. Based on feedback from the executive, the committee print shifts the bulk of this bill's requirements from OSCE to DC Health. DC Health will procure, stock, and manage the undesignated medications in school, as well as implement the training program for staff by enhancing the existing administration of medication training already offered by DC Health through its grant of Children's School Services. OSCE does still have a role, as the committee print requires OSCE to oversee the school compliance with this act, including obtaining written proof of compliance from each school on an annual basis and supporting schools with resources to implement the requirements. To reflect the changes made to the bill as introduced, the committee print did change the title. Overall, the committee print for this bill reflects the testimonies at the hearing and establishes a more robust plan for administration of undesignated emergency medications at schools, as well as related procurement, distribution, and disposition processes. This came up a little bit during our breakfast this morning with the state board. I believe they had a resolution around seizure medications. And so this bill actually would allow for DC Health to make those necessary changes. At this time, I'd like to open up the floor for discussion on the legislation.
Chair Henderson.
Councilmember Parker.
I have a question. I recall at the hearing, OSCE raising concerns around operational challenges that the agency anticipates with oversight of schools and storing medications. Has the committee solved those concerns, or where are we today?
I think a lot of OSCE's concerns was in that in the introduced version of the bill, they were responsible for procuring the medications and making sure that it got out to the schools. In this change, it would be DC Health that is responsible for procuring the medication and getting it out to schools. One of the other things that, and part of that was, so OSCE does still have the EpiPen program under its administration. The difference is that the EpiPen program pretty much runs very seamlessly because there is a nonprofit organization that has providing the pens free of charge, but also does a lot of the administrative back end work. And so I think that by us acknowledging the limitations of OSCE's health team and moving this over to DC Health, which obviously works more in collaboration with schools through the School Nurse and Health Suite program, that should alleviate some of the concerns that OSCE raised earlier.
Quick follow-up question, specifically to the storage of the medication. Was that taken out of the language of the bill for OSCE to manage the storage at schools of the medication? Because I recall that is something they objected to.
Yep. So now that is DC Health.
Understood. Okay, thanks.
Yep. So at least when we're talking about albuterol and glucagon, they don't have the same type of strict storage rules as some other medications which require refrigeration. So I think we are going to be in the clear here. Councilmember Allen.
Apologies, I appreciate it. We have been working with some families around from our school board member, Brandon Best, who had brought forward and part of our conversation earlier today about the seizure-free schools. And one of the kind of hangups that we've had in trying to draft legislation to take their resolution into practice has been, I think, some of this issue. So as we've been trying to work on the draft on this, I would anticipate that this helps address some of the issues around the school's ability to make sure they can provide either medication or others. I just want to confirm that that's kind of your thinking and how this would work as well, correct?
Yes. So one of the reasons while this bill was introduced with albuterol and glucagon in mind, and we had already done EpiPens, which would get to some of the allergic reactions that some kids might have to materials they didn't know that they were allergic to, DC Health made the suggestion that they be allowed to add to the list in rulemaking, as opposed to us needing to go through a legislative process every time we want to do it. So I think that this, to the extent that Representative Best in your office wants to have a conversation with DC Health to make sure that in the initial rulemaking allocation, seizures are part of it, I think that's totally fine. But I think that we feel like this limits the need for us to have to come do legislation each and every time.
Right. And appropriately gives DOH the flexibility to make sure they have the best practices in place without having to come back through a legislative effort every single time.
Right.
Yeah.
During the hearing, they talked a little bit about even changes in sort of administration of glucagon.
Mhm.
Now there's, it was like a gummy tube type
Mhm.
thing that you could. So anywho, if we specify it, DC Health's concern was that if there's a new type of medication or a new delivery mechanism for said medication, they would have to come to us every time they wanted to do something different that might be better suited for young people.
Got it. Makes a lot of sense. Thank you.
Thank you. All right. Any other comments or questions? Okay, hearing none, I'd like to move the committee print and the accompanying committee report for Bill 25-226, the Access to Emergency Medications Amendment Act of 2023. All in favor, please say aye.
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 All opposed? Okay, let the record reflect that that was a unanimous vote, but I believe that Councilmember Gray did have to leave, so he was not part of that particular vote. So if we could just make sure that that is reflected. And before I go into the last measure, I do want to give a shout out to our intern Naya Cook, who worked on this legislation and the committee report. Okay, so the final measure we will consider today is Bill 25-244, the Prescription Drug Monitoring Program Amendment Act of 2023. This bill was introduced by Chairman Mendelson on behalf of the mayor on April 11th, 2023. This legislation would expand the authority of the director of DC Health to disclose information related to the prescribing and dispensing of covered substances. The Prescription Drug Monitoring Program was launched in 2016. It monitors the prescriptions of all controlled substances and other select pharmaceutical products. The program enhances patient safety and care by ensuring legitimate use of pharmaceutical products in a manner that does not impede the appropriate medical use of these controlled substances. Bill 25-244 would authorize the director of DC Health to disclose aggregate and summary data stripped of all personal identifiers to a person or entity for statistical research, educational, or grant application purposes. The bill would also allow the director to disclose information for the purpose of public health surveillance to designated DC Health employees within the Center for Policy Planning and Evaluation. The bill would also authorize the director to charge a fee to offset the operational costs of disclosing certain information under the program. The committee print makes one substantive change to the bill as introduced by requiring that any funds generated by the fees from the program be deposited in a special purpose revenue fund for the use within DC Health. At this time, I'd like to open up the floor for discussion on this legislation. Okay, hearing none, I'd like to move the committee print and the accompanying committee report for Bill 25-244 with leaves for staff to make technical changes in consultation with the Office of General Counsel. All in favor, please say aye.
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 Aye. Okay, let the record reflect that that was the unanimous vote. I could have said all opposed, but you all said aye. So nonetheless, anywho, this concludes today's Committee on Health meeting. The time is 3:21 p.m. and this meeting is adjourned. Thank you all. Thanks.
Happy birthday to you. Happy birthday to you. Happy birthday, Madam Chair. Happy birthday to you.
Thank you. Appreciate that. All right. Y'all have a good one.